to an extent. It's saturated to an extent that no air is in the sterilizer. As soon as air is in the sterilizer, sterilization will be impeded, and we are not going to get effective sterilization. And so the saturity of the moist is very, very important. And the chemical indicator also tests that. Any questions so far, kindly? Okay. And then exposure. And so we want to make sure that it gets that time of exposing. So these components are very, very important, where pressure and humidity are also inclusive. Any questions before I go to today's section? All right. Now, we were supposed to go to chapter 3, and I'm skipping chapter 3, and I will send the slides to our participants, chapter 3 and chapter 4. Now, chapter 2, no, I'm going to skip chapter 2, and then chapter 3, and then chapter 4. And then we will go to chapter 5 and chapter 6 today. Now, chapter 2 talks about medical terminology. I know a lot of us on this platform are doctors, nurses, and a lot of cadets, and so I don't want us to bother ourselves too much when if I was teaching the sterile processing technicians, and then I will go to that. And then the reason why we have to treat the medical devices, the medical terminologies are that they have to know the medical terminologies for them to be able to know the kind of surgeries that they are doing. And then the medical terminologies, we have the root. That is the only way. I mean, they are scientific names. So you have the root, you have the prefix, and then you have the suffix, right? And so when you divide these, the names into these three parts, you will be able to pronounce them well and understand. And so I'm going to leave that. I gave the slides last week. And so I want you to go through them, and then you ask me questions when you want, there is anything that you don't understand. And then the chapter 3. The chapter 3 is anatomy and physiology, right? Anatomy and physiology, again, our nurses and our doctors, with the exception of a few, those who are non-medical or non-health practitioners or employees or cadres, that will be the first time that you'll be looking at the anatomy and physiology. And so I want to take that also out, and then I will send the slides for you to go over them. And then the next one is microbiology, right? Microbiology. And the microbiology is also very important. And then the anatomy and physiology is very important for the sterile processing technician to know why. Now, this is a technician who is working in this very important facility or department. He or she will have to know how the body works, from the cell tissue to the organs and so on and so forth, how they work, how the respiratory system works, and even why there are cases that we are doing surgery. In the same way, in the real sterile processing setting, right, you will be given the count sheet, you'll be given the procedures of the day, which is linked to each physician. And so you have to be acquainted and speak the same language of the medical team for you to be able to pick the cases with the software, the soft goods. Those are the consumables, the packs, right? Let's say orthopedic packs. And then orthopedic packs are different from laparoscopy packs. And so you would have to know all those things. And that is why it's very, very important for the sterile processing technician in a real scenario for them to know all these medical terminologies. Because sometimes the OR will call you and then they said, okay, we need this pack. We need this laparoscopy instrument. We need this, that. You should be able to know the terminology. So it's very, very important. Now, coming to the microbiology, yes. The sterile processing technician would have to know how microorganisms, how they develop from one and how they multiply, how they are being identified from color, from size, and all that. And so it is very, very important for the sterile processing technician to know that. Now, I will send those slides, and then you go through, and then next week, because of time, and then we have that constraint, we want to go through the ones that you are not conversant with them. With that said, please, any questions before I go to today's section? All right. Now, 5. Any questions, please? All right. Now, you can see, everybody can see the slides, right? Okay. Now, regulations. In every setup of the healthcare that we do, we are binded by specific mandatory laws. I don't know of Ghana, and I know Ghana, we have it. Now, for the purpose of the exams that you are going to take for your certification, you would have to know these mandatory rules and regulations. In the same way, the way we want to take this sterile processing in the spectrum of Ghana Health Service, we want to also develop all these standards. And I know we have standards. And so, as a sterile processing technician, we have to know these standards, whether we like it or not. The reason being that we will be able to okay. Before I proceed, let us take a roll call before we proceed. All right. So, Madam Joyce, would you want to take the roll call really quick? We have 37 people. Please, if you are
37.
not,
Okay.
if you are not
Okay.
coming today, you are not going to get your money. It's very, very important. So now we have 37. Okay.
37.
Yes,
Okay,
please, can you go?
can we know the number of people from Eastern Regional Hospital? Eastern Regional Hospital. Can we see you by hand? Is it possible?
All right, this is what I will do. When I mention your name, and that is why it was very, very important, like we said, you go by the way that we were talking about, right? And so, again, Abigail Lade, where do you work, please? Abigail. 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 Please, if we don't know, it will be very difficult for us to send your money to you. Okay. Echa Deborah. Okay. Adi Fred. Ejapon Francisca. Please, can we respond kindly? Please, can we respond?
Nana, I'm not
Yes.
too sure, but when I joined the other link, I realized that I was muted. So
Yes,
I
you
had
can.
to go back.
Yeah, you can unmute yourself.
So please, if you are muted, you can unmute yourself and then let's hear from you.
Yeah, who is Phoenix Hot? Phoenix Hot 10. Who is, please, can you change
Please,
it?
you can rename yourself by clicking on where your name or this thing is on the right side and
Okay.
then rename yourself. Okay.
Madam Joyce, because of time, I want to proceed, and so that
Okay.
we will figure this out the next time.
Mhm.
Okay. All right. Now we were talking about regulations and standards. Now, as a sterile processing technician, under all health service, you have to know your standards, right? And the regulations in which you are working, right? And so standard, a uniform method of defining basic perimeters, right? For processes, products, services, and measurement. This is very, very important. And so as a sterile processing technician, you have to know the standards. These standards should be uniform, define the perimeters, the processes that you are doing, the product, right? The services and how it can be measured. Very, very important. Now, types of standards, right? We have regulatory standards, right? A comparison benchmark that is mandated, right? And so in sterile processing, we are mandated with certain standards. If you do anything otherwise, you are not in compliance. Simple put. And then when you go on to do that, you will be fined legally, right? And so a time is coming that Ghana we will get to where all standards now we are building the guidelines, and then we will send it through the stakeholders, and we will come up with the standards. And so we will be working with the AMI standards. You cannot do anything without those AMI standards, and they are mandatory, very, very important. And so you have to work through these standards so that you make sure you are doing the right thing. We have voluntary standards, a benchmark that is strongly recommended. Now, if something is recommended, it is not mandatory, right? It is telling you that, okay, you have to do this. And it is usually sometimes recommended by professional organizations, and then guidelines, and make sure that it's like a best practices. But regulatory means they are mandatory and it is binded by law. And so when you flout it, you will be fined. And so we would have to get to where a sterile processing technician, if you don't do what you are supposed to do and somebody gets infected by the standards without going through the standards, you will be fined legally. And so as we going through this process, I know it's a long way, but as we started this the primary project, pilot project. We will go through gradually, and then we will get these certifications where the hospitals will be certified. Now, statute, right? A written and enforceable law enacted by a governing body, right? Voluntary standards are sometimes incorporated in federal. And so for Ghana, it will get to a time that some of these written and acted laws in the realms of the health sector, right, will become laws that we will be binded as sterile processing technicians. For example, for example, should you not sterilize something and it is used on a patient and the patient gets infection, right? And you are not being able to prove that the process went through the stages, the quality checks of where chemical indicators were passed the way it's supposed to pass, get accepted. You did not run the load with a biological indicator. You did not run the load with a biological indicator to read it to certify that the tray is sterile, and you use it on the patient deliberately because probably we don't have the tray and you want to save the patient and you use it and there is a problem, right? That law will be enacted, right? And so that you will be fine. Very, very important here. Again, central sterile technicians must be familiar with these regulations and standards. Why? The reason is we have to be compliant with regulation, mandatory, so that we don't fail. Because should you fail, we have to, as a country, as a health service department, right? Because sterile processing is one of the ultimate, the most critical, important areas, right? We have to enact these standards so that we will be compliant. When I went to the facilities, right, you see that there are no compliant measures. Instruments are left in the solution. You see bioburdens glaring, right, with your naked eyes. Nobody is checking it, right? Nobody's checking, nobody's documenting. Infection prevention is not following up. Quality is not following up. So we don't have that enacted regulations to force them, and the instruments are used on patients. When we come to the next section, that is infection prevention and control, you see how important that we have to get to where we will be using aseptic and aseptic, right? Aseptic and asepsis, right? Then you get to know that, yes, we have to get these mandatory standards. But whereby the facility doesn't have these serious laws or standards or regulations, they end up doing whatever they want. Again, many regulations are voluntary guidelines focused on workplace safety. For example, I went to all these facilities and you see that somebody is using their bare hands. Somebody is not wearing any PPE, right? And then even the PPEs that they are wearing, they are not reusable and they are reusing it, right? And so workplace safety is compromised. We are endangering our employees to their families and the patients as well. Awareness of regulations, right? The sterile processing technician should know, should be aware that I'm working within these standards. And so consciously, morally, right, ethically, right, I have to work through within these standards. But if they don't know and they think there are no standards, no regulations, no bylaws, no statutes, right, they tend to do whatever they want. And then that leads to infection. Okay. Again, knowledge of regulatory requirements and state of art professional practice. If the sterile processing technician knows that, hey, I have standards that I have to go through, right? Before I come to the start work, I have to test my machines to know the efficacy of the machine, how the machine is going to work. I have to test how air is being taken from the machine, how steam gets into it, how to inspect. All these regulations are there. If he or she has knowledge about it, right, it will reduce infection and we will move in a way where the department will have a benchmark. The department will run a way that we will reduce infection. Hey, what is the main goal of sterile processing? What is the main goal of sterile processing? Can somebody tell me, please? Madam Sewa, can you tell me? If not, if Madam Okansi is there. Madam Joanna Okansi. Okay, so I have somebody responding here. Infection. Okay, so infection prevention and then material supply. Is that what you wanted to write? Okay, all right. So, again, we have to be careful, right? Compliance with standards and regulation to protect welfare of patients. Should we run sterile processing, right, without no regulations, we are putting our patient in danger. The quality of care, patient experience, very, very important. Each healthcare facility has their pillar within that operate. And I strongly believe that in Ghana here, right, one of our pillars is better patient experience and quality of care. And so should the sterile processing technician who is working in this critical area doesn't know any standard and they are working anyhow, they go to they eat in their department. The standard says there should not be even water in the department. There shouldn't be food. There shouldn't be clothes, right? Our street clothes should not go there. These are mandatory standards, regulations. And so if they don't know this, right, they are bringing their clothes from the house, bring it in the department, share the bacteria on the instrument. They don't wear gloves, right? They don't do washing, wash out, right? They don't, you have somebody having their eyelashes all over the place. You have their nails, artificial nails, and all that, right? All these in sterile processing, we have standards. That tells you that you cannot even wear ring, you cannot even wear watch, right? You have to cover your hair. The only thing that should come out your eyebrow, right? There has been event related where these things has caused infection. These are standards. But if we don't know and we don't comply, what is going to happen? Infection. Again, federal regulation agencies. So for the purpose of these exams, right, and then this certification, you would have to know the Food and Drug Administration regulation. And so Ghana, we have it here. I strongly believe that sterile processing technicians, should you ask them, what are in the United States, we call it the federal laws, right? And here, probably they will call it the national laws or something like that, right? For example, all these uh, chemical indicators, biological indicators, the machines that we use within the regulation of the state. So the regulation of Ghana, Food and Drug Administration, right? Those regulations speak, they talk something about those classifications. We have class 1, class 2, and class 3. The class 1 is where the things are not critical. Class 2 is semi-critical. Class 3 is critical. So example of class 3 are peacemakers, right? And so the Food and Drug Administration will look at this and they will have regulations, mandatory regulations that you have to run with it. And so a sterile processing technician would have to know that. Center for Disease and Control. The sterile processing technician would have to know what it pertains with their department. Very, very important. Department of Transport. Why? I think last week somebody asked me a question. One of the cadets asked me a question. He said, Nana, how are we going to transport the instrument from one place to the other in order not for us to cross-contaminate? Yes, in sterile processing in Ghana, we would have to get a Department of Transport where the Department of Transport will have a regulation, a standard, how those instruments, soil instruments, are transported from one department to the other, point of use to the sterile processing department. You cannot just hold them in your hands. What of you holding them and in the way you bump on somebody and then it all gets on the floor? What are the regulation, the step-by-step processes that you use to mitigate, to treat this per risk management, infection control, quality, very, very important, transport. And so what is the mode of transport? Do we put it in a containerized, sealed it so that it doesn't soil? What is the transport agency? What are the regulations for it? Very, very important. Environmental protection, very, very, very important, right? If we have decontamination area, which should be a negative pressure, right? In our environment in the hospital setup, should that room become a positive, what will be the implication, the reciprocal effect of our environment? Is very, very important. Very, very, very important. So the sterile process technician would have to know that. FDA, functioning with the public health service, very, very important. They will have to know it and know where to go, what to do, and what not to do. Yeah. Does somebody have a question? Okay. What does it regulate? Now, the FDA, like I said, it regulates the sterilant. And so the FDA is the sole agency. We should be in Ghana here, and then we will get to that level where they will make sure that the sterilant, for example, if it is low temperature, hydrogen peroxide or plasma, gas plasma, or ETO, right? The sterilant, at to what temperature should the sterilant reach to kill microorganisms? Regulates. They regulate this, they regulate the high level disinfection. The sterile processing should know this. And I trust me, this is going to come in your exams. The manufacturer of the device, the FDA does that. The pre-market clearance. Now, the class 2 medical and the class 3 medical equipment, they should have pre-market clearance. Very, very important. It's very, very, very important. Class 1, like I said, this is general, right? Right? So the devices, what are the devices? Right? We will come to that. They're subject to general control, exempt from market submission. With the first class, the Caesars and the thermometers and all that, those are class 1 medical devices. They don't need any pre-market submission, right? Now, medical devices, the class 2 devices, they need, right? Because they are potential risk. When you use them, right, it can lead to infection. Hence, you need market surveillance and you need pre-market notification. In this classification of FDA, for you to put this through, it is called 510K. That is what this form of notification and submission is. Should we go to FDA right now, and then you are bringing new class 2 medical device, you have to go through this. If you don't go through this, you are not, or you cannot be, it cannot be used. You should not be permitted to use it, right? Now, class 3 devices, these are stringent, regulated. Stringent, it requires market application. You have to put application through it. Studies should be done through it before you get approved to use them. These are examples of the low class 1 devices, the laparoscopy instruments, ultrasonic, right? The surgical instrument, right? Now, the sterilizers and the chemical indicators, and I'm going to explain this a little bit. Now, the chemical indicator, why is it class 2? And it needs pre-market approval. This chemical indicator is telling you that when you use it, it's telling you that if it passes, right, through the process, right, and it gives you an accepted result, it is telling you that the instrument is safe or sterile to use. Hence, it is if that particular device does not meet that qualification, right, that pass from FDA, and then you use it through the process, the instrument will not be sterile, although the material will say it passed. But because it did not meet the criteria that it's supposed to meet, right? No. And then the instrument is being used on the patient. I'm going to come
for the audit attest.
Please, somebody is talking and the person's phone is not mute. Kindly mute it. And then let's say your sterilizer. The sterilizer is class 2 device. Why? Because it's the sterilizer which is going to sterilize, which is going to use the process to make sure that the instrument is sterile. And so if the sterilizer is not working properly per FDA approval, and you use the sterilizer, it cannot kill the live spores and the bacteria. So it can lead to infection. Sterilizers are number one. Chemical indicators are number one. The packaging, the wraps that we use, the containers. So it's very, very important. Class 3, right? Class 3 are the implants, the heart valves, right? The warmers, the peacemakers, the implants. Very, very important. Those ones have stringent regulations. Now, in the act of sterile processing, right now, in the act of healthcare, we have to be morally correct. What that means is that when there is anything, we have to be able to report, right? Safe Medical Device Act, right? And if Ghana, we don't have it, it's going to be the time with the help of ICD leadership and Ghana Health Service, current Ghana Health Service, we will get to this stage that we will go through this act. It's very, very important, right? Healthcare facility require. Somebody want to talk? All right. And then healthcare facilities are required to report events. Very, very important. Now, in 2022, in 2000, right, medical facilities were required. That is in the States. And here too, it should be mandated, which I know that they are doing it, right? That if you suspect that a medical device is not working properly, I've been in other facilities that you see right away that this medical device is not working correct. But because the technicians doesn't know, because the technicians doesn't know that this is class 1, this is class 2, this is class 3, they don't know. And so even if it is not functioning properly, they are not able to even report because they don't have anything to substantiate that. And so we have to get to where all these things will be reported, right? We call something the MedWatch program, where people in the department, in the hospital, listen, as a sterile processing technician, you are a patient advocate because these instruments are used on patients that they don't know. And so they have to be abreast with all this information to be watchdogs, right? MedWatch, where they will report issues untimely, right? It's very, very important. And then we go to where an action taken if a medical device violates FDA regulation. I've not seen it in Ghana here, but should the sterile processing technician know all these and knows the manual that he or she is using, knows the regulations, they will report immediately, right? Report to FDA, and then these risks will be reduced. Now, criteria of FDA recall, right? Class 1, high risk. There are chances of product, right, will cause serious health problems, right? Now, if the instrument or the things that they are using is not done properly, or the machine does not meet the requirements of FDA, then we can recall them. But has there been even a way or a time that a medical device, somebody has brought a medical device from the States or donated? We don't even check how the machine is being used, whether it has passed its end of life or is obsolete, right? They brought it to us and we are happy and we start using it. It's very, very important that we have to look at all these things because some of these machines, some of these instruments, they are end of life. And when they bring it, we don't even sterilize them the proper way. It's very, very important, right? Class 2, less serious risk. Class 3, low risk. Labeling, right? How these instruments are being labeled, relabeling reusable medical devices. You cannot do that. Very, very important. Document require manufacturer. You have to comply by manufacturer's criteria. Again, provide sufficient instruction when the sterile processing technician should know the equipment that they are using. The IFU, I keep saying it, all those who met me, wherever I go, I say the IFU. If you have a phone, how do you operate the phone, right? And so these equipment should have manufacturer's instruction, and the sterile processing technician will have to know that. Confirm, right, that they have facilities, equipment to execute it. I have been in facilities that even the machine is there. They cannot use it. I went to another facility, and you could see that this machine has sat down since COVID because they don't have the capacity, right? And so we got to look at all these things. Again, reusable, single use. I went to a lot of facilities. They are using the disposable and they are reusing it. Something that is single use, right? They are using it. And that is very, very wrong. And the sterile processing technician would have to know it. I'm giving you an example. To know that this is single use, you see that they have a circle, and then if it is R will be written in it, and then they will cross it like this, right? It tells you that it's single use, right? Hence, because the sterile processing technician and even our health team leaders, they keep on using the same thing. That is serious health issue and leads to infection. Again, what should be or should be demonstrated that the instrument, right, any institution that reuses a single-use item, this is what you have to do. You have to make sure you clean it appropriately, but you cannot clean it because, right, you have to go by the manufacturer's instruction. And so should we want to do that because of constraint, because of financial issues, stakeholders will have to sit down, right? Infection prevention, quality, pharmacy, the disease and control department, they have to sit down and come up with policies, ways, how, because the manufacturer is saying if you reuse it, it's not effective. The material that we use to manufacture it doesn't give you the opportunity for you to reuse it. And so if you want to reuse it, then you have to go through all these stages. There should be a sit down team, look at all these things. Very, very important. Hospital reuse options, right? Again, if you want to do that, like I said, there should be multidisciplinary team to look into that. And then you look at the processes and go through stringent FDA regulations. And so there should be steps they meet, they do assessment, risk assessment, and then they look at what they should be doing, right? They evaluate the reusing versus what the manufacturer says you cannot use, right? You have to look at all these things before a set determined uh, analysis, initial analysis cost will be made. And then if they go through all these processes and the hospital is well convinced and they want to do it, even if you do that, you have to report it. Very, very important. Okay, disease and infection, right? Disease, Center for Disease and Control, right? Department of Transport, like I said, and then occupational safety and health. Now, I have talked about the disease and control, right? Disease and control. What do? It's an agency that collects and analyzes data about infectious diseases, right? And then issue infection control guidelines. That is what they do, right? And then Many CDC guidelines and recommendations are incorporated into health facilities, policies, and procedures. And so that you will see CDC, right, in the guidelines, sterile processing, you see part of it in there. Transport. What is the mode of transport? You carrying or transporting soil items from one place to the other. It always have to have indication, visual indication that says biohazard, right? This is a mandatory. And so should the infection prevention director or focal person see you transporting an instrument from one place to the other, which does not have this label, you have to be talked to. Very, very important, right? Now, the day control, right, is a federal, or here, like I said, they will say, I don't know where they put it, right? But then the Department of Transport, right, in its whole spectrum of policies, should have the way biohazards are transported, which I know they have it, because when they're transporting this highly biohazard waste from the mining companies, you see them that they have, when you are on the highway, especially from the these roads, the Kumasi to Obuasi, you see that they have this biohazard uh, tax, right? And so they have it, and then we have to bring that same concept in sterile processing. If not, then the sterile processing team, the health service department, they have to look at that. So here, Central Sterile Department that transport minimal clean items between facilities to another facility, right? From the operating room, from the dental clinic, from the labor and delivery, from the OBGYN to sterile processing, even the facilities where they do the processing in the OR, you see that it is in their hands, right? That is not a proper way of handling soil items, right? And then even when they are transporting, they have done the assembling and they are sending it from the where they did the decontamination and then sending it to the sterile processing department. Sometimes you see that they put it on a mobile truck, just like that, and they put a towel or something, and even the towel has been used in the OR, right? That transport mode is not the way it's supposed to be. There should be a clear policy, transport policy, stringent transport policy to prevent cross-contamination. Any questions, please? Any questions? Any questions, please? Any questions? Let me see if I have any questions here. Okay. Any questions, please? I see that some Achimota team came in and they were locked off. Please, have they been able to log back? Have they been able to come in?
We're finding it very difficult coming back.
Wow. We are just.
Isabella, please. Isabella, are you on? Isabella was finding it difficult joining. She was seen and was logged.
I had to use the
Probably,
whole.
probably 86. I don't know, but we are just 62, and we have it's like we have 300 and more people can join. So, can she kindly do it again, or they can join you in your room, please? All right. Any questions? All right. Now we have to be looking at state right? We have to get it will get to a time, or in Ghana, in our setup, we have to get the state and then the local, that is the district, the regional, right? Should we follow all these policies or the state policies at the same time, right? These are some of the things that happens. The area in Accra here, right? The Accra hospitals are different from the setup is different from those in the northern region. And so if you decide to use the same perimeters or the same standards, the same regulations, the mandatory one, right, that they are using in Accra, and you want them to use the same thing in, let's say, Paga or whatever, the northern part, you're not going to achieve anything. And so we have to look at these. It's very, very important. Those in Accra, although we have national standard, locally, the district, the one who is living even the quality of water, right? They cannot do anything about that water. Hey, in healthcare systems, right? Supplies and resources are always limited. And so those out there, if you give the same bench or the same regulation, it's not going to be possible. And so we got to look at all these things. Very, very important. And no, although we want the same quality of care, but since they don't have what we have in Accra here or in Kumasi, the local also would have to come up with regulations, not something different, but a regulation that will meet whatever they have there, but not compromising quality. EPA, right? It was established in Ghana, here in the United States, right? And so we'll have to look at when it was enacted in Ghana, right? The population and pollution and all that it looks at. In sterile processing, we do the same thing. If the decontamination area is a negative pressure, or if it should be a negative pressure, which means air is not leaving that department. If it is a positive pressure, it means air leaves there, right? But because anything in the decontamination area is considered contaminated, the air should be negative so that it does not contaminate the environment. So we need to look at all these under the EPA department, EPA regulation, right? Minimizing of greenhouse gases, minimizing toxic emission, regulation of reuse of soiled waste, controlling odor air pollution, developing and enforcing pesticide regulations, right? FDA. We have to look at it. Very, very important, right? Looking at the sterilants, the detergents. If they aerosol, right, they don't contaminate, right? The person cannot inhale it. If they inhale it, they are not going to have reciprocal health effects. Very, very important, right? We have to look at all these, the sterilizers, the sanitizers that we are using, the chlorines that we are using. And I keep mentioning that the chlorines, very strong. They open it, it's always opened, right? And the technicians go there, they don't cover their noses, right? And they are inhaling all this aerosol. What is happening? We got to look at all these things. We have to get policies to regulate that. Very, very important, right? Very, very important. The bleach that we use, very, very important, right? We have to look at the manufacturer's instruction, the labeling, right? I went through all these facilities and I asked the manufacturer's instruction, right? The labeling, I couldn't find it. And then we mix it anyhow. Mixing of these solutions, detergents, are very, very important. We have to go by the policies. Clean Air Act enactment. As a sterile processing technician, you have to know all these things. OSHA, Occupational Safety and Health Administration. This is solely for your workers. So healthcare, ICD, right? The Ghana Health Service, Ministry of Health. How are we looking at our employees, right? You go and they will tell you we don't have enough of PPEs, right? This is where an employer An employee can report to FDA, can report to OSHA, and OSHA will take them up. It is mandatory that you have to give them free PPE. It's very, very important. This part, I'm putting it out there, and I want leadership to take it very, very seriously, right? OSHA, very, very important. Occupational Safety and Health Administration. What are we doing to these employees? Are we sending them because they are troublemakers and we are sending them there? Or because we don't regard them, or one way or the other, right? What are we doing? Even to our other cadres, right? They go to the departments without masks. I went to one of the facilities, somebody went to the street and was coming from the street, enter into the OR, right? We have to enact all these policies. Very, very important. Very, very important. We have to give the employees, the Sterile technician should make sure, or the employer should always, at all times, give them PPEs. Very, very important. Very, very important. We shouldn't expose them to gas. Look at how my lady is dressed here. This is how a sterile processing technician should dress. And it is under the act, right, of OSHA. Very, very important. Very, very important, right? Employees are exposed to hazardous toxic chemicals, right? Again, the chlorine that we use, right? I went to Parazone. I went to one of the hospitals, they said Parazone. The Parazone that they are exposed to is very, very dangerous, right? OSHA takes care of it. And so the employees should know that, right? Being exposed to bloodborne pathogens, right? Protect employees, very, very important, right? Now, we have to enact some specific team that can go into these facilities, and we have to, as employees, report when we are not safe. Very, very important, right? If you violate, these are the fines that you'll be fined in the US. And in Ghana, we have to enact, we have to enforce these things, right? In America, when you do it willingly, right, you are charged within this amount of money. And Ghana, we have to enact these things. Very, very important. Very, very important, right? State agencies, like I said, the Department of Health, Department of Transport, EPA, and so here we will say Environmental Protection and Authority, or how they call it, right? These are the mother ones in the state, in the Accra, the ministries, but in the district, I know we have it, but then we have to make sure the balances where what the hospital here in Accra has everything, and those in North doesn't have anything, yet we want them to live to that same expectation. We have to balance it. Very, very important. Any questions, please? Okay. Professional association, right? Develop and promote voluntary standards that set foundation for workplace practices. Very, very important. Amy. Anywhere I go, I make mention of this. Amy standards, right? Amy standards, ANSI Amy ST79. This is the standard that I used in doing the baseline assessment. Association for Advancement of Medical Instrumentation, AMI standards. The sterile processing technician will have to know these. These are voluntary organizations. They have about 6,000 individuals, right? With 375 organizations. What do? They are technical advisory groups, right? They have set the standards. And so these are the standards that we have to bring in our sterile processing department. These AMI standards cut across the water that we use, the medical devices that we use, right? Some of our team, even in our hospitals, we don't know these AMI standards. It's very, very important. Advancement, right? The advancement, right? Association for Advancement of Medical Instrumentation. And the biomed team, they have to know this. Very, very important. Of head, very, very, very important. Right? And then ANSI, American National Standards Institute. And so you always see ANSI AMI, ANSI AMI, ANSI AMI, because the American, and so in Ghana, it will be a time when we keep on doing this sterile processing and we set national sterile processing IPC advancement or whatever name that we will give it, we will be able to have our guidelines where it will be a standard that we will use it as regulatory mandatory start that we will use. Very, very important. Very, very important. Right. And so what do? Right? They enhance the global competitiveness of US business and America quality of life by promoting, right, and facilitating voluntary consensus standards. Right. Now, so in Ghana, Madam Joyce, I know her to be one of them that with the technical group that they set, they go, and I know Dr. Sewa is also one of them. And so we have to be more stringent on in these things and enact them and have them in a way that they will be enacted. If you don't follow, you get fined. Very, very important. Very, very, very important. AIR, Association of Periop Nurses. I know that we have it here, right? And then it works hand in hand with sterile processing, because the surgical procedures that we do, the medical devices that we use, very, very important. Association for Professionals in Infection Control and Epidemiology, right? Our IPC team, IPC is the voice, IPC is the soldier, IPC is the inspectorate, IPC is the person who should be correcting all these things. And so we have to know these policies, these standards offhand. ISO standards, right? Global non-governmental organization, right? They, again, a lot of people have heard me saying this. The ISO standards, when any standards do their submission, they compare it. All these standards are in ISO. They are all in ISO. Again, Joint Commission. This is a commission that goes to hospitals, right? And so in Ghana, like I said, we have to get to a stage where we will set a team, a national team. They are from different hospitals, different professionals, and all that. That body should be a body that is not controlled by the government. That when they come to your facility, they look at the quality of what you are doing, and then they have a benchmark, and then they will come probably every year. And so in our proposal, we said that we will set something like Ghana IPC, right? Ghana IPC Advancement Certification, where every year we will disseminate to all the hospitals, and then we will be looking their standards, right? Very, very important. Very, very important. The National Fire Service Protection Association, in the hospitals, we have to get them. When there is an emergency, where are we going? Do we do practices? Do we do acts and all that to make sure that where individual is, when there is a fire, where do they go? Very, very important. Very, very important. United States Pharmacopoeia National Association is also in sterile processing, right? Again, what do? The medications, some of these chemicals, that they use, they are all under this association that we have to do as sterile processing technicians. WHO, and then European Emission for Standards. And so if we are able to get to the level, we as Ghanaians, we as Ghana Health Service, we will also set our own benchmarks, our own standards, without borrowing anything. We will set ours like we are setting sterile processing guidelines. And that will be the guidelines for if it is reviewed and accepted, right? That will be the guidelines for the whole Ghana, right? And then we will have the SOPs, and then we will have our policies. Should it get accepted and the technical team sits on it and approve it, ICD, with the help of Dr. Lawrence Oforibuedu, Dr. Kufu, Joyce, and the team, Dr. Madame Kumi, and the other doctors that I can't mention all their names, they have started doing this. The Alpha Health Group are building all these with them. And very soon, when they are cleared and agreed and approved on, we will start using them. Again, Association of Gastroenterology Nurses and Associates, right? This is where they use the scopes, right? The scopes that we use, we have to get an association for them, right? They are policies. They are specifically, they deal with flexible scopes, because a lot of issues are coming out from these scopes, the didionoscopes, right? The ENT scopes, right? The lower and upper scopes. All these scopes has to come under one specific body where they will be looked at and have policies and procedures. Again, Ghana Health Service is working with Alpha Health Group to come up with all these guidelines and state policies. Now, Central Sterile technicians can ensure compliance by becoming familiar with all these standards and regulations because they have serious impact in our jobs. Very, very important, right? And if we don't pay attention and we do whatever we want in this department, that is why we are having a lot of infections, right? And we have to keep abreast with changes, standards. Every now and then, we are having sophisticated machines, equipment, scopes, instruments, medical devices. The medical devices that was used in 2020, there has been a lot of versions. I can give you an example of the feeding pumps. Right now, we've gone to where there is a feeding pump that it gets calibrated and then it's used for different patients, right? And do we have that? Sterilizers. We are having naked sterilizers in our department. Naked sterilizers, which means it's only used to sterilize single instruments that cannot be packaged. We have moved past that gravity sterilization. We've moved past there a long time. Right? So we have to be abreast with time, abreast with the new changes and standards. Compliance in our job, right? Sterile processing is in the middle. The sterile processing technician. You see, all these agencies are around the sterile processing technician for the purpose of this certification and our job to do it effectively and to get results and reduce infection. We have to know all these agencies. Any questions, please? If you want to have any idea or any information, you can take a picture of this screen, and then I'm giving 2 minutes to take a picture, and then you can go through it, and then you can be reading about them. Any questions, please? Any questions, please? Now we are 57. Madam.
Hello, Nana.
Yes.
Please, where I am, we are 98 here.
Oh, okay, that's fine.
Yeah, so some people couldn't join through the link that was shared yesterday and today, so they used the previous one.
Okay, that's fine. So we are 98, right? Okay.
Here, yes, here we are 98 here.
Okay, all right, that's fine. So far as we are all in the same place, any questions before we go to chapter 6? And I will do that before 6 o'clock. Chapter 6. Any
Yeah,
questions?
there's a question here. Yes, please. A question, Joseph, Medical Village, Eastern
Go
Region.
ahead.
All right. So I know in some hospitals, they are what we call the quality assurance team, who go about taking data on how quality is assured on all the processes, including sterile processes. So I would want to find out how different is the quality assurance team of which IPC is incorporated with this one.
Okay. Ask your question again, please.
So in some hospitals, we have quality assurance team, which of which IPC is also incorporated. Now their job is to see into quality way of doing things, quality standard way of doing things, and standardizations, among of which IPC is also included. So I would wanted to find out how different is the operation of the quality assurance of which IPC incorporated with this one.
Okay. Thank you very much. If I understand your question, in Ghana, quality infection prevention and control has been put together, correct? Is that what you said?
Yeah.
Okay. Now,
my question is ended now.
Okay. Thank you very much. Now, let's look at infection prevention. Let's look at infection and let's look at quality, right? Now, I want somebody to give me the explanation of quality, and I want somebody to give me the explanation of infection. And then we will marry the two. And then you will see the answer, and then I will add mine. I want us to, as healthcare practitioners, I want somebody to give me the definition for quality and the definition for infection. I don't know, but I think probably because of staff constraints and other things, that is why they have put these two together. I cannot explain for Ghana Health Service. But in America, or where I have studied and where I have go, these two entities are doing two different things. Although at the end, right, they will come and then it will come for all will come to the end for a quality of care. But somebody should give me the definition of infection prevention and definition of quality. If I don't hear anybody's name, I'm going to call. Or if nobody volunteers, I'm going to call. So, do we have, I have somebody that I know. Okay. Janet, Mensa Janet Emefa. Mensa Janet Emefa. Can you give me your background and give me the definition for infection? Okay, who has raised up his hand? Let me see. Please, the one who has raised up his hand, can you please talk?
Nana, please, this is Comfort from the Eastern Regional Hospital. Yes, please.
Go ahead, Comfort.
So, to the best of my knowledge, in Ghana, I know that those two units are not together. They have components of both that overlap, so they work hand in hand. But to the best of my knowledge, they are two separate entities. However, to define quality, I would say that quality to me is doing the right thing at the right time for the right person to achieve the best possible outcomes with standards in mind. That is what quality is to me.
Okay.
Thank you.
Thank you very much. Anybody to give a definition of infection, please? So you are saying doing the right thing, and then making sure is what?
So doing the right thing at the
Mhm.
right time,
The
in
right
the
time,
right way.
in the
Yes,
right.
for the
Okay.
right person
Okay.
to
Which means
achieve the best possible outcomes
okay,
with
that is quality.
standards in mind. Yes.
Okay. All right. So can I have somebody to give me infection, please? Infection. Infection.
Nana, this is Roland, Eastern Regional Hospital.
Why is it that Eastern region are the only team answering? I want
Please, I'm
somebody.
raising
Okay.
my hand. No one is calling
Oh,
me.
Please,
sorry. I'll back down. Sorry.
thank you very much, Roland, my good friend. Please, the one who raised up her hand, can you please?
This is Rachel from Achimata Hospital.
Oh, wonderful, Rachel. Go ahead.
Yeah, so when we say infection is when, let's say, harmful germs like bacteria, virus, fungi, or parasites enter the body and then they start to grow inside our body.
Okay. Infection. Okay. All right. Now, given looking at the definitions that right, quality is when you are looking at a standard. Right? You have standard, right? A benchmark, right? That this is what we are doing, right? We have to get here, right? It has a grade, it has a degree, it has excellence, right? We have to get here, right? If you are going to school, right, and then you have been given a quality of your mark that should you be able to get A, right, you will be able to go to the A schools, right? Now, if you want to be a doctor, all right, you have to get A in biology, A in chemistry, A in physics, and all that hard maths, right? That is the quality standard that you have been given. It's a standard, it's a degree, it's a grade, right? And so in Ghana Health Service, where you have the you have the you have quality and infection put together, right? What it means is that you set a benchmark, right? You set this benchmark. Okay. We want to do this in this manner. And if we do this in this manner, whereas we are going through that area, we are looking at the things that if we don't do, right, we will not get infection. Or if there is an infection, what can we do to mitigate those infections? The portal of entry and all that, right? And so the quality is the benchmark, the standard that we say that, okay, if we do this is excellent quality, right? The, the standard that here to here. And then the infection group, right? They are making sure that, okay, if this thing comes here, right, what can we do so that this particular thing will not spread? The virus will not spread. That will be we are washing our hands. But the standard is we want to make sure that should the person wash their hands, the person does this, the person do this, by the time he or she leaves the hospital, the person will know that this person he or she was treated properly, right? He get the right attention, right? And then from there he left the hospital without getting uh, anything from the hospital that he did not bring from home. Please, do you understand what I'm trying to say? The gentleman who asked the question, please, do you understand what I'm trying to say? Hello, are you there? Can anybody hear me?
Yes, please.
Yes,
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 please.
Nana, we can hear you.
Yes,
Yes,
please.
right. And
Yes,
so,
I'm the one. Yes, I'm the one who asked the question, so I'm following.
okay, so The patient came, and then the patient is sick. Right? The patient is having some virus. Right? And then he came to the hospital. Instead of when the person sat on the table, or he or she has C. diff and touched the door, right? We did not clean it. But the standard says, right? Clean it as soon as you see a trace of C. diff, right? The standard is clean it immediately with the wipe, with the bleach, or with whatever that you have to use to clean. That is the standard. When you are able to use that bleach, right, that infection, you have controlled it, you have prevented it. And by so doing and acting on it immediately, you get to the standard where the next person touched it, and then he or she did not get the infection. So you see where I'm going to. So infection and quality, they work hand in hand, but at the end, the infection team are doing whatever they have to do to get to the quality level where the work will be excellent. The patient will come to the hospital. Even if the patient does not get infected, he gets the best care. There was a scan machine. After the scan machine, everything was documented. The patient left and he or she was contacted. When was he coming back, right? The physician followed up. The nurses made sure, right? Even when he or she was leaving the hospital, they led her, they got him or her a transport to go home. Those are quality processes. Quality, a standard, excellency, excellence. Any questions, please? Okay. Chapter 6. Can we see my slide, please? Chapter 6. Can we see it? Infection prevention and
Yes,
control.
please.
All
Yes,
right.
please.
Yes, please.
Okay. Nobody is talking, so can somebody talk for me to go ahead? It looks as if I'm doing the talking. Can somebody give me the definition of infection and prevention and control? I know we've said it, but I want somebody to, I don't want the one that how you understand it, although I just explained it. But with this that we are going to do, you see how it is being married to. Can somebody tell me how infection is, sterile processing is controlling infection, or its main goal is infection control? Can somebody give me like 2 minutes explanation on that?
It's the processes.
It's the processes. Okay, thank you very much. Who is this, please?
Yeah, this is Gloria at Hospital.
Where?
It's the processes and Achimota Hospital.
Achimota Hospital. You guys are doing so well. You are. I want somebody from Tema Hospital or somebody from Madame Sewa's Hospital.
Then they will continue.
Say that again.
I said, let me
Nana,
finish
please,
my.
there's a hand up.
Whose hands is up?
Eastern Regional Hospital, Nana ya Boahima.
Yes.
Nana,
This is Nanaya Boy from Eastern Regional Hospital, Koforidua. So, when we talk of sterilization, helping to control and then to prevent infection, it simply means we are carrying out this process, sterilization, to ensure that someone who is not already infected with any pathogen or disease-causing organism doesn't come into contact with these organisms. And if there is the organism present, we try to control it. So we are trying to curb it to prevent it from going to other places or coming into contact with other people.
Okay. Thank you very much. Whose hands is up again?
Medical Village, Joseph,
Okay,
Eastern Region.
Medical Village, Eastern Region, right?
Yes, please, Koforidua.
No, hold on. I want somebody from Greater Accra. Hold on 1 second. My Greater Accra,
Okay.
where are you? Kolebu, do we have FEMA on the Fema, is Fema here? Fema. I'm trying to
Yes,
mention.
please.
Okay, Fema, thank you very much. Fema, how does, if we say sterile processing is to control infection, how?
All right. So that means there are some standard precautions that we would have to follow. For instance, hand hygiene, and then the use of PPEs, and then trying as much as possible to also keep the environment clean. With all of this, we'll be able to reduce the spread of infection.
Okay, thank you very much. I want somebody from, I've got somebody from Achimata, I have somebody from Tema or Kolebu. Tema or Kolebu. Do we have Tema team here?
Yes,
Tema.
yes, Tema, we are here.
Aha, Tema, can you please help me? Gloria, can you please help me?
Yeah. Infection prevention and control is just measures that we put in place to prevent infection from spreading to other people, healthcare workers, and patients. And then the control are measures that already, if the infection has spread, we put in place to limit the spread to other people or further spreading to healthcare workers, patients, and their relatives, and then the working environment. And these are, we have precautions that we put in place. Hand washing, PPEs, decontamination and sterilization, housekeeping, and waste segregation. So if all these precautions are put in place well, you will prevent infection from spreading. And even when it finds its way into the environment, it will be controlled so that it will not further spread to other people. And with the sterilization we are learning or looking into, it's just how to keep our instruments safe. After disinfecting, we further sterilize the instruments so that the microorganisms that we couldn't stop their spread during the disinfection, we stop them during the sterilization process. Thank you.
Thank you very much. You have all done really good. We have our director, ICD. I want to do this submission 2 minutes, then I will ask our director to say something. So, Central Sterile, in short, all of you have done very well. Central Sterile main goal is to prevent infection. How? When any reusable instrument or medical device is used on a patient, whether it's used on the patient or is open at point of use, the end user, when the barrier of sterility is broken, that is when it is opened. Whether it's used on the patient or is not used on the patient is considered contaminated. Hence, you have to treat it with universal precaution. Universal precaution here means when you are handling those instruments or medical devices, you have to be full PPE. By the process of, I'm talking about infection. This is under infection prevention and control. When you handle these instruments with universal precaution standards, you handle them, you process them the way the manufacturer tells you to do it. You making sure that you are transporting them, that is where the regulations comes in. Transporting them from one place to the other, making sure you don't do cross-contamination. You bring it to decontamination area, Where the decontamination area has their confined temperature, monitored temperature, and a negative air pressure, which is not letting air go through the prep and pack area and also the hallways and also cross-contaminating to other departments, you are preventing infection right here. Treating the instrument per each process, where you inspect them, clean them per the manufacturer's instruction, clean them properly, using the right tools. The right tools can be brushes, water. Water is very, very important. Water is very, very, very important. Wearing these PPEs, cleaning them, and if it is not clean, it's not sterile. If it is not clean, it's not sterile. This is food of thought that I want us to put in our head. Now, let's go to our homes, right? When you are cooking, why is it that you buy the tomato, you buy the banchi, and you are going to do your soup or you're going to do your fufu? Why is it that the banchi that you brought from the market, you don't just put it put it in water and then start boiling it? Because when you boil it, right, everything on the banchi will get killed, and then you take the banchi and then you pound it and you start eating, right? Why is it that you peel it off? You wash it nicely, and after washing it, you throw the water away, you put it in another water, and then you wash it probably twice. You put it on the water, boils, and the whilst it is hot, right, you cover it. You don't want flies to sit on it, right? All these processes that you do in your homes, right? Even when you are cooking soup, right? I'm coming to our homes, and then I will use that as a yardstick and go to our facilities, right? Now, your soup, you are boiling your soup. If you finish boiling your soup, even the soup is on the burner, right? Cooking, and you see that cockroach is in the soup. Are you going to eat it, or you take the cockroach, you throw the cockroach away and you drink the soup? Are you going to do that? Right? And so it's the same thing. The processes, the lay down protocols, the best practices of handling this instrument, cleaning them, treating the instrument at point of use, right? Point of use immediately. Don't bring the instrument to the department, the sterile processing department, decontamination area, before you start cleaning. So there's going to be a question, and the questions that you are going to ask at the end of your class will be, where does decontamination starts, or where does cleaning start? It starts at point of use. So you do point of use cleaning, you spray, you reduce the way of cross contamination. There and then you succumb, right, the infection, the bacteria, to where they cannot grow, and then you bring it to the decontamination area, where air cannot live there, right? Airborne pathogens cannot live there. You clean them, you disinfect them, you put it through thermal disinfection. They are processes. You are killing whatever got contaminated from the patient, making sure everything is done properly, goes to the prep and pack area, you clean it, inspect them. It's clean. Don't forget, food of thought. When it is not clean, it's not sterile. And then from there, you assemble it. You put your chemical indicator in there. You do your temper locking, right? Like you are cooking, and then you finish, you cover it. And then you make sure you don't open it for fries to go in there, right? And so from there, right, you put it through the sterilizer. You make sure the barrier of your packaging, right, is preventing infection. And so by doing all these things, you are controlling infection, because the infection that went into the instrument when it was used on the patient or open on the patient room right now has gone through a very stringent process: cleaning, handling, packaging, right, closing it through a sunstick packaging, right? And then you are sterilizing, keeping sterility. By so doing this consistently with standards, you are controlling infection. Before I go to the slides, I will give the opportunity for Dr. Lawrence Oforibuedu, or is if I don't know if it is Dr. Oforibuedu or Madame Akufu to give us 2 minutes talk, and then we will move on to our chapter 6 really quick. Please, is
All
Dr.
right.
Akufu?
Yes,
Yes.
I was trying to wasn't. So good afternoon,
Good afternoon, sir.
Good afternoon,
everybody.
Director.
Good afternoon, Director.
I was trying to join along the line. I just finished one letter somewhere, so I really wanted to enjoy what's going on. I think to me, as I listen to the discussions, what comes to mind is that how can this processes reduce burden of the cost that we pass on to patients through overloading patients with antibiotics because we have introduced some infection during surgery, or we are not too sure of the sterile processing. As I go through the country, facility to facility, now almost every surgeon prescribes antibiotics after surgery. Why? The reason being that most surgeons are not too sure of the processes, or they are not too sure of the environment they operated, or they are not too sure of any reusable item that went through any process. So after every surgery, we prescribe antibiotics. Have you sat down for a moment to estimate the cost we are adding to patient care and the burden of antimicrobial resistance we are introducing? And so to me, it scares me a lot when it comes to issues of sterile processing and reusable surgical instruments, how we process them. And that's the reason why I believe it is time that we set standards. We set standards for facilities to follow these standards and protocols in Ghana. And those facilities that are not meeting the standards will not be allowed to sterilize any usable items in their facilities. This is the time we have to hold the bull by the horn. So until we are able to be very strict and follow the rules and get the approvals from the ministry from these pilot sites, after the pilot sites have done their work, I'm in a hurry to get the ISO certifications for facilities so that standards will be met, because healthcare associated infection is causing a lot of burden on facilities, a lot of burden on the health system in Ghana. And one of the areas we have lost sight for so many years is about our sterile processing department, where our gauze are packed for sterile for sterilization, where our reusable surgical items, labor ward items, emergency ward items are sterilized. Where I've gone to see some facilities sterilizing reusable instruments with microwave, some sterilizing with some outdated autoclave to our clients. It's not creating the safety environment. So I'm in a hurry. I don't have so much time to be laboring on the processes, but then I believe that we need to go through the processes to we get to the end. So I'll be grateful that facilities who are joined and are learning start putting these practices into these protocols into practice, whilst we at the national firming up these protocols and seeking approval by the end of the pilot phase. A lot of these practices are going to be introduced, and we believe that through the pilot, we will get an outcome that will inform us to review these IPC protocols, especially in the areas of sterile processing, and make it a policy and a national policy that everybody will abide. And through this, I believe we are going to improve quality of care and safety of our clients. We are going to minimize surgical site infections. We are going to minimize antimicrobial resistance. That is causing a lot of huge burden on our finances, and most facilities are losing a lot of money through people who are supposed to be staying in a ward for 4 or 5 days to treat their surgical site wound instead of discharging them in the second day or third day, passing on a lot of costs and burden to clients. And so as a service, we have no hesitation to ensure standards. And that's the reason why I'm particularly interested in this course and making sure that people are certified and the facilities are also certified to go ahead. Facilities that may not cross the border when we are taking off, we will have to compel them to sterilize their processes, their surgical instrument in another facility that is certified. And because we don't want to get there, we are encouraging as many facilities to go through the process and get certification. Other than that, when we take off, we have no option than to pull you to go and sterilize your instruments for another facility that has certification before you can use them. And that is the way we go until we make sure that every facility receive the minimum standard to do minimum sterilization based on the level of practice. So I want to add my voice to this process that let us take it seriously. Let us go through the process. Let us appreciate it. Let us make it our context specific. And so that by the time we are able to revise the SOPs and the protocols and have approval from the ministry level after the pilot, we will all be very safe. We will be very clear in our mind what ought to be used for sterilization, what ought to be used for disinfection, and certain outmoded practices will be over because we cannot use them again because they may not qualify to pass the test. Certain chemicals we are using may not be used again. Certain types of covers or packaging we are using, we may not be able to use them again. We will be able to where we are going. So I'm grateful. Let us all take it very seriously. And I believe that we'll be able to achieve what we intended to achieve during this process. Thank you very much for the opportunity.
Wow. Thank you very much, my doc, our leader. I will not say a lot about this wonderful leader that I have met. He has been a very big, influential person in my life since I came to Ghana. Doc, good job. Good job. So thank you very much for coming. We really appreciate it. On that note, we will jump to infection prevention and control slides. We will move really quick on that. And so the objectives, as a result of successful completion this chapter, the scholar will be able to explain sterile processing technician in a healthcare facility infection prevention and control effort, discuss personal hygiene, protective equipment, and then sterile processing protect patients and themselves.
Sorry to interrupt. Those on Zoom, we can't see your slides.
Wow. Okay. My technical man, please start working on this for me, please. Other than that, I really apologize. When we finish, the slides will be sent to you. Besides that, does everybody see the slides? This is infection.
Right now. Yes, now I can see.
Now we can see.
Yes, now.
Now you can see, right? Okay. So
Yes, please, you can see. Thank you.
Define the term. The scholar should be able to define the term standard precaution, which when I was giving the definition, I kept mentioning that, saying back and forth to be able to define that standard precaution and list key elements in blood pathogen standard published in OSHA, that is Occupational Safety and then Health Administration. Describe basic environmental concerns as sterile processing works in a designed area. It's very, very important. The sterile processing area should be well designed, not just anyhow, well designed. And then also the work procedure, right? Low traffic, that is, the area should be clean. How many times should it be clean? And then the term, right? These terms, asepsis and aseptic technique. Please, I want us to lay more emphasis on this. Aseptic. My good doctor my director said, right, the physicians give these antibiotics because they are not sure of sterility, right? Now, when we look at this asepsis and aseptic technique, right, we have to start living where we are administering by, administering antibiotics and heading towards asepsis and aseptic technique. All right. And so eliminate and destroy all potential infection contaminants, right, present on reusable instrument. That is prevention, right? Infection prevention control, goal of sterile processing. All that we want to do, that is our main job, right? By following all those processes, those standards, regulations, mandatory regulations, voluntary regulations, right? By following all those, we want to eliminate, destroy potential infectious contaminants on reusable instruments, because these reusable instruments are going to be used on another patient, right? Going through the cavity, right? Whether invasive or non-invasive procedure. Very, very important. Safety distribute reusable and single use, right? Now here, let's underline the word single use. Single use items that are being reused. They process it and reuse them. If the manufacturer says something is single use, if you decide to reuse it, process it in any way, you remember on our first discussion when we were looking at standards, right? We talked about single use. If you want to forego the manufacturer and reuse a single-use item, there should be a board from the facility. You set a board from stakeholders. You do risk assessment, risk analysis, right? Look cost effectiveness, right? Look at all modalities, sit down, look at all these things and see how this material can be reprocessed. By so doing, we have to go back to FDA and report all these things to them, because probably reusing it, the sterilant that FDA have approved, right, might not be compatible by the process of reusing it. So we have to look at all these things, making sure we distribute these reusable items without cross-contaminating it or having event related, and distributing it with efficacy and maintaining sterility, making sure that we are saving patients. Again, establish and enforce standards, right? Doctor said we have to, or we are going to get to where if your hospital does not get a certification, right, accreditation from Ghana, the way doctor will, or doctor and Ghana Health Service will name it, either infection prevention or infection IPC sterile processing advanced accreditation. If your facility does not get this accreditation and you don't meet or follow all these standards, hey, you are not going to be allowed, right? So standards are going to be enforced for decontamination area. How we decontaminate items from point of use treatment, coming to the decontamination area, cleaning, using cavitation process, right? Where instruments that are difficult to be cleaned, we use cavitation process or ultrasonic to clean them, right? Use the right brushes, use the right equipment, right? Use the right steps, microscopes, right? Inspecting it, going through all those processes from decon, the right disinfection, moving from the chlorine and using enzymatic solutions where the activation on the enzymes will break the surface, right? The surface of the soil. When the instruments are heavily soiled, how we get treated it, you spray it, the enzyme breaks the surface, make it easy to be clean. Very, very important. Not making it to be clean, you are destroying the instrument. The enzymes are broken down, right, to reduce, to kill infection, making safe to be sterilized. Very, very important. So these things are the things that infection control is looking at. Again, medical devices that have not been properly handled, disinfected, or sterilized, right? They cause infection. They can cause serious infection and to our staff, right? Our staffs come from home, they wear their shirts, their mufti, their street clothes, right? They go home, they sit in this trotros, the taxis, the Ubers, and then they go to this sterile processing area. They handle this instrument. From there, they wear that same cloth, right? They have eyelashes, they have nails, right? And then the microorganism can hide under these nails. They can hide under your eyelashes. There has been event related where these things transport, right? Cross-contaminate from the workplace to your homes. And then you get your family infected. Very, very important. So we have to be very careful the way we look at how we handle instruments, soil instruments, and we disinfect them and sterilize them. Now, approximately each year, right, we have about 100%, 10% of patients hospitalized, right? Through this has been increased, this particular percentage has increased, that they go to the hospital and they get hospital-acquired infection. Again, the primary purpose of sterile processing is to stop spread of disease-producing microorganisms in healthcare facilities. So like doctor was saying, I'm hitting on that part because it's very, very important. Our physicians, they are trying as much as they can, but the standards are not there. The regulations are not there. The best practices are not there, right? The consumables are not there. The supplies are not there, right? The equipment are not there. And so what we are doing, right, instead of the patient coming, the physician is not sure. Not that they don't know, they know, but they are not sure. And so with the help of ICD department and Ghana Health Service, now they want to come in terms and come up with these processes. Not that we don't have, we have, but we have not been well structuring it, well documenting it, well enforcing it, well enacting them. So it's very, very important. Again, appropriate attire, like I said, right? You cannot wear your street clothes or bring scraps from home and then you take it to the sterile processing department. And then when you finish, you take it home, you wash it, and you bring. No, time has come that all these scraps, attacks need to be controlled. That controlled in the hospital. Control in the hospital, right? We have to process them. We have to clean them. We have to wash them. We have to disinfect them in the hospital. And then we take them in. They stay in the hospital. Even our sneakers that we wear should be stayed in the hospital. You shouldn't leave the hospital. Uniforms, hair cover, right? And then when you are covering your hair, everything should be covered. Your ears should be covered because there has been an event related where we have infection from our ears, right? That gets infects the instrument, and right, and then you have to wear long overcoats, right? That will cover all your hands. I have seen trays that have hair in the tray, cuties, a lot of things in the tray, chewing gums in the trays, and so we have to dress properly. Very, very important. Shoes, we have to wear non-skidding shoes, so that we don't fall. Workplace hazard, very, very important, right? We have to wash our hands. You wash in, you wash out, right? When you handle, before you handle the instruments, and you don't want to wear gloves, you have to wash your hands, right? And then you handle the instrument. The reason why some people don't want to wear the gloves, there has been a lot of events where you have pieces of the gloves ending up in the tray, get sterilized. And then when they open it on the sterile field, you see the gloves, parts and pieces of the gloves, right? And so, yes, we understand. If you don't want to wear the gloves, and somebody will say, when I wear the gloves, I'm not able to handle the instruments very well, I'm not able to inspect it. And some people wear gloves and they get reactions, allergic. Yes, we get all that. If you want to do your bare hand, you have to wash your hands. You wash it, wash in, wash out. Very important. Preventing infection. How sterile processing is directly, right, controlling infection. And the part of the biggest control of infection in our facilities. Remove waters. This is a standard. This is mandatory. Don't go with the sterile processing room with long earrings, with your golden watches. Please, we are not saying you are married, don't wear your rings. If you want to wear it, then put gloves. I don't want to see it. These are standards we are going to enact seriously, right? Chain. I don't want to see chain. I don't want to see your earring. Cover them, right? Bracelet, watches, no. Entering into that area is highly restricted. Again, wash your hands, soap, water, and then alcohol, right? Again, PPE, personal protective equipment, PPE. This is what we call standard precaution, treating everything that has come in contact with patient or open at the patient end of use need to be treated with standard precaution. What does that mean? Wearing your full PPE. And please, my team, my wonderful cadres, this is how you have to dress. Very, very important. Very, very important. These are the supplies. These are the consumables that we have to make sure we wear to save our staff and also patients. Very, very important. Very, very important. Right? That is OSHA. Right? This is how you have to dress in your decontamination area. General purpose, right? Utility gloves, right? Soil resistant. Why soil resistant? If you wear a gown that water or liquid can penetrate, right? Blood you can go through or mixed with all these things, go through, touch your body, you get infected. Some of these solutions, when they come in contact with your body, you get burns. And so the water that is mixed with this contaminated bacteria from the patient, when they splash on your attire, should not penetrate, right? Should they penetrate, you can get infection, right? Blood-borne disease, right? Airborne disease, very, very important. And so again, PPE, specifically fluid-resistant covering sleeves. It has to come all the way here, and then your gloves should be all the way here. Very, very important. Your foot coverage should come to your knee. Specific PPE supplies, consumables, very, very important. Very, very important. Full face protection. Full face protection. I've seen somebody working in decon did not cover their face well, and then everything splashed in their face. The person got blind. Very, very important. Seriously, you have to get full face protection. Again, consumables. This is very, very important. So, my wonderful facilities, these facilities that we are going to go, is very important for us to get these PPEs to protect our patients and staff members. Very, very important. Right. Shoe covers. And then resistance. So this is how it should not soak, right? The scrubs should not soak. When it splashes, liquid splashes, it has to be like the second one, right? It should not soak it. Very, very important. By doing all these things, you are preventing infection. The infection from the instrument is not going to your staff. Very, very important here. You are not spreading it. You are not spreading it. Very, very important. Because somebody can work in decon, get this splash in their attire, right? Or scraps, and then they go to prep and pack area, carry that infection that was at decontamination area, go to prep and pack, and then prep instrument. And then I strongly believe, because I've seen it, right? You go to these hospitals, when I was doing the assessment, you see that the person moving from the decontamination area and going to the operating room, right? With the water and everything all over the place. Very, very important here. The right supplies, the right consumables. Again, standard precaution. Place emphasis on the use of blood and body fluid precautions for all patients and all instrument medical devices. Very, very important. OSHA, right? Pathogen standards, right? Written exposure control plans. I know that when I went to the facilities, I was asking them, right, what are your exposure plans? Right? Train upon hiring. So the sterile processing technician should be trained upon hiring what these exposure controls are, right? The plans. When something gets on the floor, right? How risk management should come in. The right solution, the right equipment, how to gun up, how to treat it so that infection does not spread. Very, very important. This has to be done before the person, when you hire the person, you have to be trained and annually. Very, very important. I don't know in Ghana, but hepatitis B vaccine should be given at no cost. That is part of OSHA, right? OSHA, very, very important. Observation of standard precaution, right? Use of engineering and workplace controls to reduce infection. By doing all these things, we are reducing infection big time. My wonderful participants, should we be doing this, following these policies strictly, stringently in our facilities, these pilot facilities, we are going to reduce infection drastically that the nation will be surprised. I'm telling you, the little that with even the resources that we have, by following these stringent policies, right, stringent processes, we will be able to reduce infection. Again, the provision of PPEs. You go somewhere and they say we don't have, right? I went to some facility, I used my hair cover to do my shoe cover. How is that possible, right? All your shoes, from your shoes all to your knee, should be covered, right? So proper PPEs, right? At no cost. I know that is what we do, but we have to do better. We have been doing, but it has to be better. Very, very important. Acquiring the right procurement and sustaining it, very, very important. Provision of clean and sanitary working environment. Use of appropriate biohazard signs. Last week, one of my participants asked me, how should the transport of mode be? When we are carrying soil items, it has to always have biohazard sign to show that the person who is approaching you to know that what you are carrying is biohazard. Is biohazard. The same way, when we are sending clean and sterile items should also be indicated, clean or sterile. Very, very important. This should be done and label so that label that they are contaminated. Very, very important. Again, they should be in a rigid, right, rigid containers for sharp disposables. I know resources are, hey, but again, we cannot be using boxes, right? I went to some facility and they were using corrugated boxes, right? That is not acceptable, right? Covered, punctured, proof containers for transport. When the lady who asked me last week, when we are transporting these items or medical devices or instruments from one place to the other, it has to be a punch proofed, where if we spray them, if we have blood on them, they cannot leak. Any questions, please? Any questions, please? Before I proceed, any questions, please? We have about 20 minutes for us to close. All right. Again, provision of medical evaluation and treatment if an employee experiences an exposure. I know we do it, but we have to make sure we follow, or that is incident report. When a patient or employee get exposed, get punched, right, with an instrument, get a cut, right, we have to follow medical evaluation. Very, very important. Properly maintaining medical and training records, right? Keeping our record, our sterilization records, so that we can backtrack, we can do bilateral tracing. When we use scopes, right, we have to align the serial number of the scope to the patient medical number, MRI number, right? So that we will know that scope number 3789 was used on patient MRI number 567. It was used on this date. And then we come back, we reprocess it, and then we will use on another patient. And so if there is an infection, we can do bilateral tracing from sterile processing standpoint, and then the end of use standpoint. Please, our medical team, if we are not doing this, we have to look at this very, very important. It's very, very important. It's very, very important. Where the medical device that we are using, the serial number goes with the MRI number of the patient. Please, can you mute yourself, please? There is a feedback. So that when there is an infection, we can say that this serial number of equipment was used on this patient. And then when was it used? What was the process? What does it look like? We can do that bilateral tracking from endpoint to the sterile processing point. And there should be documentation. The same way, we have to document our sterilization processes. The tray, who processed the tray, Alpha processed the tray. Each sterile processing technician should have a peculiar ID. You scan your tray, you get your tray scanned in the system. You know that Alpha did the cleaning in Deacon. It went to sterilizer number 2. When it came from sterilizer number 2, it went to workstation 2. Workstation 3, Alpha or Yamensa processed it. He or she processed it at 2:00 a.m. Everything should be documented. When he or she did it, it went to sterilizer number 4. It went to it at 5:00. It came out this time. The biological was incubated at this time. It came out past at this time. So the tray got dry at this time. All these documentation, right, can be looked through, can be followed. They are quality process standards. Very, very important here, right? Okay. There should be a clear SONSTIC workflow, right, where each department, right, the central sterile department means the different departments under one roof. And each department to the other, the decontamination area, there should be a physical blockade, a physical block, right, to the prep and pack area. And if there are doors, they should be closed at all times, right? Very, very important. So decontamination, there should be a physical block here. Prep and pack area, a physical block, right? And even if there should be a whole area, there should be minimal, very, very minimal traffic. Very, very minimal traffic. Very, very important. Decontamination area cannot be freely open to the prep and pack area, because the prep and pack area should be positive air pressure, meaning air leaves that place. Air leaves that place. When air comes that place, it means it will bring dust. And we don't want dust in where we are doing the packaging. That is why when I went to the facilities, I started telling them, I gave this homework to the infection prevention and the quality team. And I intentionally did that, right? That they should start the windows, right? They should start closing the windows, right? Because if air is coming there, you are introducing. If your air keeps on coming there, it means you are introducing dust into the department. And so the prep and pack area, air leaves there, positive, air leaves there. The decon, air doesn't leave there, rather air comes there, because if air leaves there, you are contaminating the environment. So you don't want to leave the decontamination area barely open to prep and pack area and to the sterilization area. If you do that, you are contaminating the area. It should be a physical barrier. Again, the method to introduce the likelihood of, that is what I just said, right? The decontamination to the clean area. The use of air pressure to control airborne bacteria. That is what I said, right? Now, you see airflow. If you look at the chart here, you see that clean air, that is the positive air, should rather be going to the decontamination area. It should not be coming from the decontamination area to the clean area. If you do that, you are cross-contaminating the clean area. That is not acceptable. And so, if we come there, these are the practices, right? We are going to check temperature and humidity, the temperature and the humidity, and the air pressure, right? We will check. These are all going to be standards. You remember, right? This goes under the VAC system of the facilities. There are peculiar air pressures and temperature at all these areas. We will get to them right now. Because if we don't control that, right, we will be spreading infection. Don't forget, there are bacteria that grow very well under cold temperature, thermal temperature, and then mini temperature, right? Okay, and so controlling air, windows from decon to prep and pass should be closed at all times, should be kept closed at all times. Now, this is where it becomes very pretty and wonderful, right? Look at the perimeters of the temperature in all these areas. My wonderful team, take note. If you can take a picture, take a picture. These will come in your exams. These will come in your exams. The temperature in decontamination area should be between, right, 60 to 65, right? Fahrenheit, and then Celsius 16 and 18. The temperature, the humidity should be 30% to 60. Be careful. This can trick you. You got to be careful. Now, the new buildings might not have these, but when we are building new facilities from now, we have to be looking at the ASHRAE guidelines, right? Very, very important. And the exchange of air should be 10 per hour, right? Very, very important. Now, prep and pack, 68 to 73 degrees Celsius. And then the humidity should be 30 to 60. Again, 10 per hour, right? Now, the cleaning area, this is very, very important. This is where the sterile items are, right? And so the temperature, any temperature below this, should we be keeping these temperatures ranges very carefully? Should you have a mismatch of temperature in this sterile storage area for continuous 1 hour, every sterile items there need to be reprocessed. Again, should you have a mismatch that your temperature is 75, 75, 80, 85 for consistently 8 hours, 1 hour, or 25 to 30, 35 degrees Celsius, right? If you have that below, right, you have to be reprocessing your items. You have to be reprocessing your item because heat, moist has contaminated your instrument. Any questions, please? All right. So these perimeters should always be monitored and documented. And so in all our facilities, we will have temperature and humidity control monitoring. Again, hand washing, fixtures,
Please,
right?
can you go over the temperature and humidity control?
All right, please, I'm there. Are you okay? Are you okay?
Nana, please, she said you should please go over them.
Okay, thank you very much. Now, in decontamination area, right? The bacteria that will go there, the temperature that you have to be using to work under that area should be 60 degrees Celsius, Fahrenheit to 65. And then the air exchange should be 10 per an hour. That is the air exchange. Temperature and humidity should be 30 to 60%. Why? If you go above or you go below, there is the propensity that the microorganisms here will grow And then the air there will also get affected. And so your process will be compromised. By keeping this temperature and humidity in this area, you tend to keep the area at a negative pressure. Prep and pack. This is where the instrument has been cleaned, disinfected, and then now you are coming to assemble. By keeping these temperatures at all times, you are keeping the area at a positive pressure. Cleaning area. By keeping this temperature and then humidity and then the air exchange, you are keeping this place also at a positive pressure area. Anything below, and the most important is the sterility area. Anything below this area, any temperature below, the instruments will get contaminated. And should it be 1 hour consistently, evidence says if you use ATP test or required test, surface running test, you will see that bacteria have started growing on the instruments. Any questions? And these are guidelines.
Nana, please. I want some clarifications. This is Nanaya from Eastern Regional Hospital, Koforidua. And with the air exchanges, are we talking of the 10-day? Is it the molecules or the speed?
Yes, the molecules. So this is how it's being tested. And when I came, I test the flow, right? I don't know if it is your hospital. When I came, I used a tissue. Do you remember? I don't know if it is your hospital. The flow of air, right, that comes through that area or that leaves intermittently, the exchange of the air, right, should in the molecule should be this per hour.
Oh, okay. Thank you.
Yes. Should it be more than this with that keeping of these temperatures, right? The air will be positive and it's not acceptable. If it becomes positive, it will leave the area. And so basically, this is under the vacuum system, right? The ASHRI guidelines, right? Where we Ghana, the estate team should be going through this. And so no sterile processing department should just be a department where they will just build it. These perimeters should be taken into consideration. And you cannot use fan. You cannot use fan. Neither can you use air condition. Should you want to meet all these regulations, you have to use HEPA filter. HEPA filter. Exhausting HEPA filter. And this is under environmental structural relaying or building of our sterile processing departments. Can I move ahead?
Yes, please. Thank you.
You're welcome kindly. Now, fixtures, right? We have to get all these areas, we have to get sinks. You see the sink here, we have to get the decontamination area, we have to get 3 pull sinks. Soak, wash, rinse. Soak, wash, rinse. We have to get all, at least one in each regional hospital. These things, the decontamination area, at least each regional hospital, each district hospital, we have to get one of these. Very, very important. Again, the requirement for storage, right? It should be, you see how the down thing is being laid, right? It always have to be covered. it always have to be covered, right? Because we cleaning, right? The mob can touch the sterile items. These are sterile items, and we don't have to place more than 2 stack on each other. That is what the manufacturer of the wrappers say. And some of these wraps, again, we are coming to our wonderful pilot facilities. We have to procure the right packaging materials. And then we have to go by the manufacturer's instruction. And then we have to label them. We have to make sure that we check event relate issues. Very, very important. The rack should be open so that when we are doing oddly, or you call it oddly, we call it housekeeping, right? They will not contaminate the instrument. And so the down shelves should be covered at all times. Traffic, very, very important. Very, very important, right? Sterile processing area. By the time I come to your facilities after this 1 month, we will discuss with ICD director and their wonderful team. If we start coming, right, all these departments, there should be this label, right? Authorized personnel only. And you should not allow anybody to go there. The traffic should be seriously minimized. And we have to wear the proper attire, which means those attires should stay at the hospital. Your shoes, your sneakers, and the sneakers should be non-skidding sneakers. The attire should stay, please stay in the hospital. We are going to work with the pilot facilities. Very, very important. And then dress code. Now, biohazard, right? In decon area, right? Biohazard should be there, and the OSHA requires full PPE, unrestricted area, normal traffic, that's the cafeterias, waiting rooms, etc., right? And then the semi-restricted area, the storage area, the corridors, the operating room, example, surgical strap, attire, and hall covers. The restricted areas, right? That is areas where the sterile products are performed, right? The sterile procedures are performed. There you have to wear your surgical scrap, right? Surgical scrap, surgical scrap. I'm repeating this because I saw things that I did not like. Surgical scraps, we were not in compliance. Hair covering, masks required, right? Persons working within the sterile field have additional requirements. Very, very important, right? What to wear in this area, right? What to wear, right? The central sterile dress requirement review, right? The decon, right? There you wear PPE, right? That is your hair cover, your nose, your glasses, your goggle, your gloves, your gown, your shoe cover prescribed. And so please, facilities, let's make ready. This, you are saving your staff and saving patients. Very, very important. Right? And then clean and sterile storage area, scrubs and hair cover, surgical area, that is the operating room, the surgical scrub, hair cover, and mask may be required because you have to wear mask before you go there, the surgical field. And so please, this is just a reminder, if we are not doing the surgical rooms, let's go there with masks, which I know you are doing it. You're doing a wonderful job. Again, environmental cleaning, central sterile processing, floors must be wet, mopped at least once a day. At least a day, right? We have, this is very, very important area, right? So it has to be wet, mopped at least once a day. Work surfaces could be cleaned at least daily. And then the lights, because we do inspections and we want to keep our lights clean, it should be cleaned every 6 months. This is mandatory. ST79 is in there, right? The walls, the cabinets, cracks should be cleaned, right? And regularly scheduled, right? To clean them. And then we document this cleaning. Very, very important. The storage area should be done nicely arranged, right? Remove sterile items and cuts and clean them thoroughly, right? We should be cleaning them. I went to a facility, and then when I used the white stuff to clean, it was a disaster. So please, sterile items is what we're talking about, yeah, right? Even your utensils that you use them in your houses, right? When you clean them and you put it in a cover, when you are going to use it to cook, you clean them before you cook with them, right? The same thing. Let's use that same concept. The food that we are eating, we boil them, yet we put our utensils and we clean. How much more things that is going through these vulnerable infected patients? We have to keep them safe and sterile. Sterile, very, very important. Allow sterile storage unit to dry thoroughly. When you're cleaning them, carefully place items back in their designated areas. We have to keep the cleaning records, right? Again, we should look at these boxes. Should I start coming again? After 1 month, when we finish our program, our training, all these boxes should vermouth in sterile processing areas, in our OR storage areas, in our ORs. I saw a lot of them in the ORs, right? These bring cockroaches, mice, bacteria. They call them shipping boxes. Shipping boxes. We don't need them. It's unacceptable. Per the manufacturer instructions, we have to, or standards, we don't have to use them. Bring them near sterile processing areas. If we have totes like this, we call these totes. Totes like this, they need to be cleaned routinely and locked. Very, very important. Please, don't take soda. You call it Fanta, Coke. Don't take them in the department. No food there. Last time I went somewhere and I saw wache. It's not appropriate, right? No food items, no drink, no water. No food should go to sterile processing department. Not near there. Very, very important, right? The work practice, the workflow. It should not be zigzag. It should be a flow, right? Logical, one way, defined, right? Cleaning, right? To storage area to where you send the instrument to the OR, right? So you do the assembly here, then you do sterilization, to storage, to transport delivery, and then to decon. And then decon, it come back. It should be one stick work flow, right? We call this the program.
No, Nana,
Yes.
please, I cannot see the presentation. I'm not sure of others though.
You don't see it?
Someone else is sharing her screen,
Yes,
so if
please.
you could.
Yeah, someone is
Oh,
sharing
yeah.
screen.
Somebody is sharing the screen?
Yeah, so it's overriding the main one.
Oh,
Kindly
who is
tap
that?
on the screen share up there on the left corner and then select Nane's own.
Who is Gloria? Gloria is sharing her screen.
Please, we got to stop this, right? I don't want any disruption, right? I am the only person who should be sharing this. Please, let's stop it. Please, if you are sharing with somebody, some people, stop it. It's not acceptable. Please. Thank you.
Okay, now I can see it. Yeah, thank you.
Thank you very much. And so this will be the workflow. Very, very important, right? We call this the progression from contamination to sterile. So the instrument, either way, right? The instrument comes as is used. Now, when the manufacturer manufactures the instrument and it comes to you, you have to treat it as contaminated. You have to treat it as used. And so when you receive the instruments clean, it's used. It has to go to the decontamination area. You treat it with universal precaution. From there, from decontamination, it comes to the inspection and assemble area. And so you see that the color is changing. And then from there, it goes to sterilization. From sterilization, it goes to storage. And then the storage, please, somebody, we're having a feedback. We're having a feedback. Thank you. And then from the storage, it goes to the user. By the time it gets to the user, it's clean again. And then the user uses it and it comes back to the progression, decontamination to sterile. Okay. Again, principle of asepsis. This is what I was talking about. Please look at this very, very important. The principle. This is very, very important. Like doctor said, our doctors are not sure. And that is why all this administering of antibiotic, the cost. I heard somebody, I was in the fitting shop, please, there is a feedback. Somebody microphone is on. The lady said, the husband said she sent her wife for delivery. As soon as they came home, the next day, he has to take the wife back to the hospital. They administered antibiotic for the wife for solid 6 months after birth. I stood there quietly like I don't know anything, right? We have to go past that. Again, asepsis, the absence of microorganisms that cause diseases. How can we do that? The absence of microorganisms that cause diseases. How can we do that? By going through the best practices. Aseptic technique, right? Any activity or procedure that prevents infection or breaks the chain of infection. My team, we can do this, right? We can do this. Medical asepsis, procedure performed to reduce the number of microorganisms or minimize their spread. We can do this, right? Surgical asepsis, procedure performed to eliminate the presence of all microorganisms and to prevent the introduction of microorganisms in an area. Principles of asepsis. You have to know what is dirty, right? You know what is dirty, and then you know what is clean, and then you have to know what is sterile, right? Keep these three conditions separate, right? Right? You remedy contamination immediately. You will eradicate. You will mitigate. You will reduce contamination right away, immediately. Know what is dirty. Know what is clean. You don't have to mix them. If you cross mixing them, and know what is sterile. By doing this, classifying this, bringing this differently, right? Disintegrating this, you are reducing contamination. Again, this is food of thought, sterile, concise. A careless attitude may lead to increased rate of infection. Infection control, manage the growth and transmission of bacteria in healthcare facilities, right? Follow all infection control protocols, recognizing contamination and recorrecting the situation, paying close attention to details. You cannot leave the instrument in the chlorine for a whole 7 hours where the night people will go. Leave it and come the next morning. I have seen it when I was going around. You cannot say, I'm busy, so the people, nobody is paying attention. Somebody should pay attention. Attitude, paying attention to details. If it is 5 minutes, please, 5 minutes, rinse it properly, per the manufacturer's instruction. Very, very important. Controlling the spread of microorganisms. It is the responsibility of every sterile processing technician and our healthcare providers and our team. Any questions? Thank you very much.
Yeah, another question.
Go ahead.
Hello.
Go ahead.
All right. So, Joseph, Medical Village, Koforidia. The session where you said you soak, you wash, you rinse. Yes. The first stage, that's the soaking stage. Let's assume we have soiled materials from theater. So with all the blood and all the contaminants in it, do you do a partial wash before the first stage, which is the soaking, or right for all the soiled, the blood that you soak, then right from the soaking, washing, and then rinsing?
No. So we have something we call, you remember in my first presentation, I said point of use cleaning. Point of use cleaning. The cleaning
Exactly.
starts at point of use. As soon as you finish the procedure and the patient, whilst the patient is being taken away, the cleaning should start at where the procedure happened. Because as soon as you leave, and this is the standard of the surgical technologist. When the physician finish using the instrument, in any process after the procedure, there should be a sterile water, right? Where we will soak, right? The best practice is to get enzymatic spray. Enzymatic spray. That is some of the consumables. The enzymatic spray, anything that is heavily soiled, we have to wipe the surface at point of use. We wipe the surface with sterile gauze, moist sterile gauze. We wipe the surface, we open the ratchets, the instruments, and then we spray at point of use. We call it point of use cleaning. From there, and then you take the instrument, you cover it in a rigid containerized container, and then you transport it from that place to the decontamination area. But the processes that we have in our area right now, we have to start the cleaning from where the procedure ends. From there, we cover it, and then we take it to the next area. And so you don't take the instrument that is heavily soiled with the blood and everything to that area. It should be cleaned and treated in the point of use when the patient is removed. Any
Okay,
questions?
yes, I'm okay.
And then when I come around, we will do some exercise where if you don't have the detergent, right? The enzymatic spray, we have to come up with something so that we will still be doing the best practices. We will soak a towel. After cleaning the surfaces, we will moist a towel. We are not going to use saline water, please, not saline water, not saline water. I'm repeating because I have seen it before. We are not using saline water. We use sterile water. We will soak it in our towel, and then after cleaning the surfaces of the instrument, and then we will go over the instrument and we will put it in the container. That will keep the instrument moist until it goes to the area for. I have a question here. How long should a sterile pack in storage be kept before use? Can it be repacked and sterilized before use? Thank you. Now, the package, please. This is a very good question. I want us to pay particular attention to this question because I have seen it and somebody's phone is on. Can you please mute your mic? Now, the sterility of a tray that is sterile, we have to go with the pack, the wrap, the current wrap. Please, can you mute your phone? I don't know whose phone. This the person.
It's
Madam
Erica.
Erica Kesewa, you are not muted, please.
Please, this question is very, very important.
Sorry.
The paper wraps that you have been using, go and check the manufacturer's instruction. We have what we call shelf life. and sterilization life. Now here, since we don't have this IR fuse for these packages that we are wrapping, the facilities, we can all come together, and then we will come with a policy that after 6 months of sterilization, if the instrument is not used, if there is no event related. What does event related means? When the instrument gets soiled, it gets moist, it gets dirty, it gets hole on the instrument, or the temper locks get broken, then it is event related. It got to be reprocessed. Other than that, we can come with one as our pilot project. We can come with one policy and say the sterility life for 6 months, which means if we sterilize the instrument and it is not used for 6 months, we have to go back and reprocess them. The other way is the containers that some of us are using, the ASCLAP containers. If you sterilize it and you have the tentive plate, you have the tentive filter, you have the correct temper locks, it is 1 year when it is not event related. Please, it's 1 year when it is not event related. The non-weaving wraps, right? That is 6 months after sterilization. 6 months after sterilization. The cardinal, right? Material, there's another material that says cardinal material, that is 1 year. So to best answer your question, now that we are having different kinds of materials that we are using packages, we are going to come up with one policy, and then we will write it, the documentation, the sterilization date, this, and expiration date, 6 months. I would want us to choose 6 months, and the reason being that the way that we keep, or the way that our sterilization packages are, they are very vulnerable. So I don't want them to stay that much. So we will sit as a team, and then we will come up with a policy that is 6 months not used. It will be reprocessed. Is your question answered kindly? Okay, thank you. All right, any questions? We have 7 minutes to go. Any question, please?
Yes, please. Good evening. My
Good
name
evening.
is Gloria, Eastern Regional Hospital.
Okay.
I just wanted to ask, I don't know if I should put it as a question or yes, so it's a question. To the best of my knowledge, I know from the hazard control hierarchy, the best phase to deal with certain hazards is at the designing phase of a project. That's where you can eliminate the hazard if you really want to get the best outcome. Now, with some of our facilities, the CSSD structure is already erected, it's been in use. I'm asking this in relation to the negative air pressure that we are to ensure. Now that we are being told, or we are now being informed that no air condition, no ceiling fan, I'm just wondering how best can we go about it to ensure this negative air pressure is ensured in our decontamination area. So that's my question.
Thank you
You.
very
I
much.
don't know if it's clear.
Yes, it's clear. Thank you very much. So
All
we
right.
will be working with facility heads, and then Ghana Health Service, ICD leadership, that each facility we will get a HEPA filter, right? The best way to do is when they were doing the department, they should have done the VAC system where we will create this positive and negative pressure. So we will collaborate with the estates department and leadership, where we will get the HEPA filter that will exhaust for us to get a positive pressure at the cleaning areas, and then the negative pressure, we will see how we will work it out where the temperatures will not get out with the windows, right? If we have fans, should we use the vacuum? The vacuum has exchange of air that comes in, right? And so we will work with facilities, and then we get air that is coming, that is controlled and exhausting itself, so that we get the clean air exchange in the prep and pack area. The negative area, we will work with facilities how best we could to get that places negative. Again, by the time we finish this first program and then we do in person, ICD department leadership, we are working on the standards and the guidelines and the SOPs. We will come very soon, and we will start doing this redirecting and all that. So stay cool. We will come, and then we will work together to resolve all these. Thank you.
Oh,
I
thank you
see,
very much.
yeah, labeling of package with ink. That is no. That is no. Do not label a pack with an ink. If you sterilize it, don't forget. If you put it in the sterilizer, it's saturated, moist, it bleeds, and it gets into it gets in the instrument, and it penetrates and gets on the instrument. So what we are going to do is, right, we will start using labeling printers, right, where we will write, it will print the name, and then it will you'll get a print and you put it on. Do not use ink, please. Do not use ink. When you use the ink and then after sterilization, you see that it has leaked. Have you thought of where those leaking went, right? Have you thought of where they've gone, right? They have gone back into the instrument, and that is contamination right there, right? Okay, so what I want to know, if the ink does not break, it breaks the barrier. It really breaks the barrier of infection, because that is ink, and it bleeds, and then you will see that it has that traveling way, the way it has bleeded, and it's all over the place. It breaks sterility. It breaks sterility, and it breeds infection. Okay. Can obsolete machines be removed and others replaced so that the needed impact can be seen? Yes. Listen, we are working on it, right? We are going to start gradually. We are doing the first phase. And so all these machines, as we go on, we will do changing of them. And again, we have to see how we will procure them. So we are coming. Take it easy. We are coming. I assure you, leadership are working. Dr. Furubuedu and his team, Dr. Kaba, they are working tirelessly to make sure we get this through. So we are coming. Just that we have to work with facility heads, the medical soups, and then CEOs to see how we can generate funds through your IDF or what the GIF and all that to get this situated. So we are coming. All will be fine. And then please, about the cleaning point of use with the enzymatic agent being sprayed on the soil, the instrument, or the surface. Please, what about reusable surgical or wrapping materials that are heavily soil? Yeah. So again, when they do the procedure, right, the heavily soiled instruments, we have to wipe them at point of use. We have to use the sterile gauze. We have to soak it in a sterile water, and then we wipe the surfaces. When we wipe the surfaces, we don't leave it dry. That is when we use the enzymatic solution. Now, the enzymatic solution does not leave the instrument dry. It breaks the surfaces, it breaks the enzymes, it doesn't let the blood and the fat dry on the instrument to destroy them. And so some of these enzymatics, when you spray on them thoroughly, it takes 72 hours to dry. And so, hey, like I said, all these things we are working to get have the supplies ready. We are working tirelessly with Ghana Health Service, with ICD team. Stay tight. We are coming. All will be fine. I assure you that. That is why we are here. That's why Alpha Health Group is here. If anybody needs me whilst we are doing this, contact your head for your head to contact me, or through leadership, and then I will come, and then we are not going to change anything now. We are going to use your same procedure and see how best we can work with what we have before we see how we will change. We will make changes until the policies and the guidelines are approved, which Ghana Health Service is working on them. The technical team are working on them seriously. We are going to make sure we use what I have, and then we make changes. Does that answer your question? Okay, all right. And then at point of use after cleaning during packaging, is it advisable to reuse sterile paper? No, 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 no. You cannot use the sterile paper, right? If because no sterile paper is reusable. Those are disposables. Those are disposables. We are going to go where we will have the non-woven wraps, the non-woven wrap. So you cannot use towels. Those towels are lint. It leaves the lint on the instrument. And then when you use it in procedure, you transmit infection to the patient and leave these lints in the patient. That is very dangerous. So we don't have to use those single-use papers and the towels in doing the packaging. That
Hello,
is acceptable. Yes, go ahead.
hello.
Yes.
Yes, our time is up,
Okay, doc.
so we need to close here.
Okay.
And then all those questions that are on the chat box, you can work on them and then use them for the next session to answer them. I think we
Okay.
want to be time conscious so
All
that
right, doc.
people will plan their lives and everything to be. So I
Okay,
think
doc.
some of the things that have gone on, I think most of the answers, you don't have them, but you try to answer them. So some of the time, leave them for Ghana Health Service to address them. If you try to answer the questions yourself, one day your words will be picked. So on
Okay.
that note, I think a lot of work is being done at the Ghana Health Service at the ministry level. So most of the questions that came concerning procurement, concerning what you think it should be, whether it should be 6 months or 1 year, what you think you can share. But I think ultimately what we will write in the policy based on our context is what will be applicable. So I'm happy most of the time you refer them to the guidelines that are going to be piloted to these facilities. And that is good. Sharing your experiences is sometimes slightly different from what the policy will say, because we are still brainstorming with all the experts to make sure that whatever variation we may have will still be what international standards say it should be. And that is where our practice, our strengthening systems are going to be. What that the international standards say it should be. And then when it comes to our context, whether air conditioning is allowed or not, we will look at all those contexts to see what's applicable. Because in some Europe countries, you don't need air conditioning because the weather is almost always cold. And I remember when we were building infectious disease, this issue came of negative pressure, positive pressure. Air conditioning is not used in infectious disease conditioning. But based on our context, we're able to design a facility with air conditioning that's still negative pressure that can be used, because the temperature of 16 to 18, you won't have it in Africa here with air conditioning. And that is some of the things that our context will have to guide. So on that note, I want to say a very big thank you, because we want to follow and go by the time. That's the reason why I've cut you in. All other questions on the chat box will be answered in the next session as a preamble. So next session, 3 o'clock, we are starting. Questions in the chat box will be used as a prelude to the entry. And then I believe that we will all be able to follow up. So on that note, I want to thank you very much. Over to you. Is Joyce or Christy here? You can take over and then let us close formally. Thank you very much.
Yeah, thank you very much, Director. And thank you very much, Nana Alpha, for that insightful presentation. Thank you all participants for your active participation today. I think from my end here, we saw up to 105, and I believe the other link also had some people. So like Director has rightly mentioned, God willing, next week, Thursday, we'll start at 3 today some people joined later, I think because of the information that was put out there. Sorry for any inconvenience. And again, please, when you enter, you log on, kindly put your name, register your name per the facility you are, and then your real name, so we can easily identify you and acknowledge you as such. Yeah, so on this note, I want to say thank you to all of us for the active participation. And then we'll have a short closing prayer so we can leave. Heavenly Father, we are so grateful to you for this opportunity. We thank you for the life of Alpha and his team and putting all this together. We thank you for our director. We thank you for everyone that is here. Continue to preserve us so by next week we shall be able to join and learn more and practice to break the chain of transmission. In the name of Jesus Christ, our Lord, we pray. Amen.
Amen. Thank you very much.
Amen.
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 Yes, yeah, Baraka Salah to our Muslim brothers. I think today we are all in a hurry to close. That's the reason we have to cut us. It's 6 o'clock. So let's enjoy our holidays and hope to meet you all next week. All the best.
Thank you.
Thank you, Doc.
Thank you and bye-bye.
Bye,
Bye-bye.
everybody.